So we see patients who have pain in radiating down their arm, and it typically starts in the neck and shoots down the arm, and sometimes described as a sharp stabbing or burning type pain. And it can go into the elbow or into the wrist or into the fingers. And that's what we call a radicular type pain. And that's the pain arising from pressure from a nerve that's coming out of the neck. So arm pain can be caused by a few different problems. If we start at the very top in the neck and then work our way down, it can be caused by pressure on the spinal cord or the nerves, and that can reproduce pain going down the arm. It can also be caused by inflammation within the spinal cord or the nerves, and that could also be in the spinal cord itself, in the neck, or it can be in the nerves outside of the spine in the neck itself, or as it goes through the armpit. You can also get compression of nerves outside of the armpit and down in the arm, around the elbow or the wrist. So as a surgeon, we have to take a history, examine patients, and try and work out where the problem is arising from, which will then help us decide what investigations are required to then pinpoint the problem. So if you're getting arm pain that is significantly problematic, limiting function, limiting movement, you're struggling to do normal daily tasks, you're perhaps getting a bit more clumsy, dropping objects, unable to use your text on your phone or type on a keyboard, for example, that would be a sign that something's not working properly. And I would suggest that you do see a specialist to examine you, to perhaps organize some further imaging, and then work out where the problem is. So when we look at patients who have arm pain, we start off with taking a clear history, trying to identify the precipitating factors, trying to identify the exacerbating factors as well. We examine patients to make sure that the problem is not arising from a joint like the shoulder or the elbow, for example. And then we will typically organize an MRI scan of the neck to look at the spinal cord and the nerves, to look for potential causes where the nerve or spinal cord could be pinched. And then we will sometimes request electrical tests of the arms. If the MRI scan doesn't show anything of significance, we will then look at the nerves outside and going from the neck down into the hand itself. So arm pain is a common problem. The vast majority of these symptoms will not require surgical intervention or an operation. The majority will settle over time with a combination of perhaps tablets for pain, physiotherapy, and time. But for those patients whose symptoms aren't settling, then surgery may be required, and that's best discussed with your specialist after appropriate imaging.